Hello, good morning, Professor.
Morning. So you are in the lab.
Yeah.
Good morning, Manoj.
Good morning, Professor.
Hi, Noor.
Hello, Professor.
These days, my brain is not clear. What I mean is, just basically, I have a headache. So yesterday also, after dinner, I went to bed and then I just slept until this morning. And then today for yesterday, same thing. So I just couldn't do work at night. The due date for the grant proposal is today. And then I hope after today, my headache will be gone. But there are a few more things that I have to do even after today. So I don't know whether I will be fine from the headache or not. Okay. Okay, hi, Jill.
Good morning, Professor.
Mm-hmm. Okay. Okay, let's start. So briefly go over the last class materials. So when you're using the laser for doing something for the tissue, there are a few parameters that you can control. And then those are wavelength and then exposure time and also how much of energy you apply and then how big you are going to make a size for the beam spot and also the energy density and power density. And among these, the most important thing is going to be the exposure time shown on here. And then actually, if you remember from the last class, you may know that why the exposure time is the most important parameter. So for the interaction mechanisms, there are a few of them. And then photochemical interaction is one of them, which we will talk about today. And also thermal interaction, and then photoablation, and the plasma-induced ablation, photodisruptions. Those are major 5 of the interactions that we can see when you are using the laser for the tissue. And the interesting point was from here. So even though those 5 or 1, 2, 3, 4, 5 are having different mechanisms for the interaction, however, they are all within this 1 joule per centimeter square to the 1000 joule per centimeter square. That's an interesting point, actually. And for the 10 to minus 6, which is the microsecond, so longer than 1 microsecond, you can have 2 interaction mechanisms. One is the thermal interaction, the other is photochemical interaction. For the thermal interaction, the difference between here and the photochemical interaction is you have a little bit higher power density for the thermal interaction, which makes sense. Basically, those thermal interaction is going to happen when our tissue is going to absorb the energy from the light. And to have a heat production, it should have high enough energy of the photon. Otherwise, there will be no significant increase of the heat. Photochemical interaction also actually cause the heat generation. However, that heat is not actually very high. And then those heat can be dissipated, which means that spreading from the source of the heat generation to the surrounding tissue in a relatively quick way. And then since the heat itself is kind of smaller energy compared with the thermal interaction, so that it doesn't really cause any significant effects on the tissue. The other photoablation and the plasma-induced ablation and photodisruption, those are all happening when you have a very short exposure time, which means that when you have a very short pulse duration time, but with a very high power density. And besides photochemical interaction, these 4 are all basically used as a ablation purpose, which means that removing some parts of the tissue. So again, here, the 1 microsecond is actually very important. So longer than 1 microsecond, you have a photochemical thermal. Shorter than 1 microsecond, you have a photoablation or plasma-induced ablation or photodisruption. So let's look at the photochemical interaction. So the one nature example is photosynthesis, which means that using the light and then generate some form of the energy source. In the medical application, the photodynamic therapy is using photochemical interaction. And also the other one is biostimulation. So photosynthesis using the light and then using the carbon dioxide and the water generates glucose. So the other way, using the glucose with the oxygen, we can have energy, but it's not light for our human. Instead, we are generating the ATP, which is the energy source for our body. And then carbon dioxide and water. But in terms of the energy point, producing ATP from the glucose and oxygen is not very efficient. Actually, most of this process, cellular respiration process, is going to be used to produce the heat so that we can maintain our body temperature. So let's look at the PDT. So for the PDT case, you are injecting a chemical, which is the name is photosensitizer. So as the name says that it is becoming sensitized when there is a light. So photosensitizer can observe the light energy by having the resonant excitation. And then after going through a few of the decay process, and then it can release highly cytotoxic reactants, which is the reactive oxygen species. And those ROS is going to cause the irreversible oxidation process for the surrounding cells. And then since we are using photodynamic therapy for the cancer treatment, so those surrounding cells means that tumor cells. So photosensitizer is mostly organic dye, and then there are like 5 steps of that happen. So as I mentioned, this table is going to be the most important part for the photodynamic therapy. So the first step is going to be excitation process. So the photosensitizer in the tissue should observe energy when you are basically illuminating the light source from the outside of your body. And then it will observe the energy and it becomes the excitation step. When it is excited into some place, and then it will go down to the ground state. During this process, it can have it is called as a decay process. So for the decay process, also there are 3 types. One is the radiative singlet decay, non-radiative singlet decay. So either singlet decay or intersystem crossing or triplet decay. So singlet decay is basically meaning from here, it goes up and then goes down into the single state. Intersystem crossing is from the single state excitation here to the triplet state movement. That is called the intersystem crossing. And then triplet decay means that from this triplet state excitation to the single state ground state. So 1 and 2 and 3 different types of the decay process. So when the decay is happening, as you can see, during the decay process, it can generate the triplet state of the excited state. And then from that, it can react with the surrounding substrate and then generate either neutral organoid or ionized substrate also. And then from this process, it generates those 2. And then from here, you can see either generating hydrogen dioxide or superoxide anions. So those itself are also actually harmful for the cells. The other reaction is from also triplet state of the excited energy state. So those excited triplet state energy can binding with the triplet state of the oxygen molecule and then making single state of excited oxygen. And then this single state of the oxygen, excited oxygen, can interact with the cell and then making oxidation for the cell, which is going to be the damage for the cell structure, mostly DNA. If you do have a carotenoid surround that photosensitizer, then this carotenoid is actually having more better reaction with the excited single state oxygen. So when there is a cell and a carotenoid, like those 2 together, then this excited single state oxygen molecule prefers to bind with the carotenoid, so that this carotenoid can work as a reducing the damage to the cell. So that's why when you are taking those color vegetable and the color the fruit, which has abundant of the carotenoid, then it can minimize that this excited single state of oxygen, so that protect your normal cell from this ROS, so that we should have enough vegetable or fruit to keep our normal cells to be healthy. And then once this carotenoid is interact with a single oxygen, and then these are going to be excited, and those excited carotenoid is going to release energy in terms of the heat, and then becoming normal state. So photodynamic therapy, the procedure is shown on here. So let's say that there is a tumor in our body, and then you are injecting photosensitizer through the IV injection, intravenous injection. After giving the injection, this photosensitizer will be distributed in our body. And then depending on the photosensitizer, some are going to take only a few hours, but some are going to take a few days. So in this case, about 2 or 3 days. So you are injecting photosensitizer and then waiting for the 2 days or 3 days. And then when you are waiting, what's happening is normal tissues are going to have a more higher the release of the photosensitizer from the body, either going through the kidney or through the liver. But those tumor is going to keep those photosensitizer within the tumor volume tissue. So you can easily imagine that at this moment, if you are illuminating laser from the outside, and then those laser will basically going through the tissue, and then the laser will deliver energy to the photosensitizer, which are shown in these white dots. And those photosensitizer will basically absorb the laser energy. And then as you have seen from the previous table, it will go through multiple steps. But finally, what it will do is that it will make a excited single state of the oxygen, which is the reactive oxygen. And this reactive oxygen is going to make cells surrounding those photosensitizer to get damaged. So not only tumor cells are going to be damaged, however, normal tissues are also going to have a damage. However, you can see the concentration difference is huge. It's like 30 times more concentration in the tumor compared with the healthy tissue. So that the relative damage for the normal tissue is small, but the tumor tissue will have a very high damage. And then since it will cause the damage on the cell, the tumor cell DNA, and then the tumor cell will go into the process called as necrosis. So I guess no one probably knows, but is there anyone who has idea about what's the difference between apoptosis and then necrosis? Jehu, you have been doing PDT, so I'm hoping you are a little familiar.
I think apoptosis is active process of the cell, and the necrosis is some passive, some accidental cell death resulting from other environmental effect.
Very close. S itself is right, but both are basically cell death. So cells are dying. However, the difference is that, as Jill pointed out, necrosis is from the external the reasons, and apoptosis is actually so-called as a natural cell death. So because when we have a cell is not surviving for permanently, right? Cell is differentiated, and then it goes into the cell death and then reproduce like that. Cell cycles are there. So apoptosis is called as a natural cell death. So it follows the cell cycle process. But necrosis is undesired cell death, which means the cell did not want to die. However, because of other external reasons, cell has to die. So in here, cell is dying because of the photosensitizer produced reactive oxygen species. So this is called as a necrosis. And then apoptosis is the natural cell death. So here are showing some examples of the PDT applications, and it can be used as a tumor treatment and also bactericidal effects. And then in here, the graph shows that without laser, you can see by combining laser with the photosensitizer together, it has a very effective death for the cells, or in here, actually the bacteria. So Streptococcus sanguis, those bacteria can be dead by combining laser and also photosensitizer together. So let's look at the photosensitizer. Most of photosensitizer in currently used for the clinical setting is the hematoporphyrin derivative. So this one is coming from the cow blood. And then taking the cow blood, and then they are making this hematoporphyrin derivative, HPD. The commercial product name is Photofrin, as you can see in this photo. So Photofrin is the product name, but the chemical name is the porphymer, the sodium. This photofrin 1 and the photofrin 2 is in the state of the powder. So they are freeze-dried powder. And then before using, you are injecting the dextrose or injecting sodium chloride, and then mix well, and then inject into the patient through the venous blood. And the photofrin 2 is having more tumor localizing chemicals compared with the photofrin 1. So dihematoporphyrin, it has 2 porphyrin rings, as the name mentioned. Di means that 2. And then those 2 porphyrin are connected by COC, carbon, oxygen, carbon chain. And this dihematoporphyrin is providing high thermal stability, and then it has a more darker color compared with just hematoporphyrin. This dihematoporphyrin also has an absorption peak at the 350 to 400 nanometers, which is shown on this graph. So here. And also it has another wavelength for the absorption. So you can see the absorption is shown as this solid line here. But for the more deeper tissue penetration, we are using the range on here, like 620 or 630 nanometers for the clinical application for the deep tissue penetration. So when you have a tissue and then tumors are under the tissue, and then if you are giving the laser from the outside, and then you will have a photosensitizer which will be accumulated within this tumor mostly. But this, for the photosensitizer in the tumor to work, to generate ROS, you need to have a photon energy to come, to reach into this region, right? If the photon doesn't come to this tumor region, then basically nothing will happen. So very important thing is you need to know where is the tumor, and then you need to make sure when you are giving the laser from the outside, and then you need to make sure that those laser can be traveling and then reaching into this tumor region so that this laser energy can be observed by the photosensitizer, and then photosensitizer can generate that radioactive oxygen species, which can cause the death of the tumor cell. So here, important thing is how deep the laser can be traveled into the tissue. Unfortunately, those blue color or UVA range is going to penetrate tissue less than 1 millimeter, only a few hundred micrometers. For this visible range in here, these are also having relatively high absorption compared with the red color here. However, these are also having less than 1 millimeter penetration depth. And then only those red color region is able to go through the tissue and then reaching the tumor under maybe up to like 1 centimeter. So if there is a tumor is on the surface of the skin, and then you can use actually almost any of the wavelength for the photodynamic therapy. However, many cases, sorry, I had to turn off this Kakao. Now they are talking about the proposal. The due date is today. So these either blue to kind of green color, they are able to go through the tissue only like less than 1 millimeter. So if the tumor is under the skin, then basically those cannot be used for PDT. So that's why for the clinical application, using the light in the range for the red color for the deep penetration. And also here in this graph, you need to see the other one point here. There is a dotted line, right? And those dotted line is representing the fluorescence. So fluorescence is happening from the single state excitation and then goes back into the ground state. And then it can generate the light. Of course, all the fluorescence light is going to have a smaller energy compared with the observed energy. so that the wavelength is going to be longer. So that's why the fluorescence is going to be in this longer wavelength range. And this fluorescence is actually is going to play as a detection of the tumor when you are using the photodynamic therapy. The fluorescence intensity is going to be depending on concentration of that photosensitizer. So if you have a more photosensitizer, you will have a more strong fluorescence light will coming out, which makes sense. So what you do is that actually not that one, but that can be expected. However, people found that the 620 nanometer emission peak is decreasing. So when you go back here, 620 has strong fluorescence emission. So that means that when you are using the laser for the wavelength here, or even here, it will generate the fluorescence signal. And then the fluorescence signal is going down when there is an increase of the photosensitizer concentration. That doesn't make sense because we can expect that those fluorescence intensity will be increasing when there are more concentration. But people found that even though the concentration increases, however, the 620 fluorescence light is decreasing. So they will wonder, oh, that's interesting. Why is that? And then they realized that in the 620 nanometers, this wavelength also has an absorption peak. So it generates fluorescence signal. However, it also has an absorption peak shown on here. And then this graph looks like fluorescence is very strong compared with the absorption. However, you need to see that those are relative unit. And then these are, for the absorption, is absolute value. So actual fluorescence intensity is smaller compared with this absorption peak here. So generated fluorescence signal is going to be actually reobserved by this photosensitizer itself. And that is called as a self-absorption. But this self-absorption is not happening for the older concentration, but only when the photosensitizer concentration is higher than this 1 millimole per liter concentration. Then this self-absorption can happen. So once photosensitizer is having higher than 1 millimole per liter, then the fluorescence intensity is not increasing, even though photosensitizer concentration is increased. But when the photosensitizer concentration is lower than this 1 millimole, and then if you look at the fluorescence intensity, then those intensity comparison can be used as a tumor cell identification. So let's say you have a tissue and you have a tumor, and then you have a photosensitizer mostly accumulated in the tumor. And then if you are giving the laser in the red light, and then collecting the fluorescence signal, let's say I will just use this one. Okay, so you are collecting the image from the surface, and then in the image, sorry, the pencil actually, I don't know, it doesn't work. So I'm using the mouse, so it doesn't really show better. Anyway, so when you look at this 2D image from the surface, and then when you see some color located, and then this location is representing the location of the tumor under the tissue. So that this fluorescence imaging can be used as a detection of the tumor under the skin. And also, it's interesting to see the fluorescence decay time. So when the fluorescence is generated in this process, this fluorescence generation takes time. So of course, it's kind of very fast compared with the phosphorescence light. This phosphorescence can be millisecond to a few seconds, but this fluorescence is like nanosecond. However, it still has a time. So when you are detecting fluorescence signal, once you are giving the excitation light and then start to collect emission of the light from the tissue, and then you can see the fluorescence signal is actually having this increase and then decrease with the time. Here it is shown as a picosecond scale. And the people found that when there are more and more concentration for the photosensitizer, so here you have a micromole scale, here you have a millimole scale. So micromole is decaying slowly, but millimole decays much faster. So by measuring this decay time, you can also estimate the concentration of photosensitizer in the tissue. So this one is called as a time-reserved fluorescence. So by having the decay time measurement, you can also identify the tumor from the non-tumor region. So let's say that you are going to have a time-gated measurements like this or maybe like this. So after giving the excitation of the light at the 0 second, and then if you wait for like 600 picosecond or maybe 900 picosecond, and then collecting the fluorescence signal intensity, and then if you have a stronger fluorescence compared with a weaker fluorescence, then you can see, okay, this region is having higher concentration compared with this region. And then you can imagine that, okay, these are probably non-tumor, and these are going to be corresponding to the tumor region. So in this example, they were looking at the just simply fluorescence intensity itself. Here, they are applying one more thing. They are applying time-gated imaging. So not just simply collecting the time, because for the fluorescence imaging, depending on the camera, the exposure time can be normally in the millisecond scale. But if you are able to have a time-reserved fluorescence, so that you can have a like picosecond or maybe sub-nanosecond scale for the time, then you can also have a way to separate between tumor versus non-tumor from the imaging. So that is the time-gated fluorescence imaging or spectroscopy, and then it can be used for the tumor detection. So this is the advantage of the PDT. You can have a simultaneous diagnosis of the therapy of tumors together. So by using the fluorescence imaging, you can see where is the tumor, which is the diagnosis. And also at the same time, if you are giving light delivery to the tumor, and then those light energy will be observed by the photosensitizer, and then it will basically cause the tumor cell death, which is the therapy. So that's the PDT advantages. So what they mean is when you have the tumor somewhere under the tissue, and then if you are giving the excitation light from the outside, and then you are taking the image from the surface from here. So you have a camera on the top here. And then if the some place is showing, I use the red color, but because the mixture with the green, it becomes the blue color. Anyway, just imagine that this is red color. So there is the fluorescence coming from this region. Then you can see that, oh, okay, this is the location of the tumor. And then what you can do is you can giving the light only into this region. Then you can minimize the normal cell death which are surrounding the tumor. So this fluorescence can be used to identify the location of the tumor, and then you can give the light to the tumor region to have the tumor tissue to be dead. So at the bottom here is showing diagnosis purpose using the time-gated fluorescence signal. So healthy cells are going to have a less concentration so that it will have a slow decay. And the tumor cells are going to have a higher concentration, so it has a faster decay. So by having this time-gated measurement, you can find out where is the tumor, and then you can apply PDT for the treatment, which is shown on the right side example. But this dihematoporphyrin also has a disadvantage because this is photosensitizer. What I mean is that even though we are using this for the PDT, however, as you have seen in this graph, these are having very high absorption in the blue color, and also this blue color here, and also the other, the visible range. For the PDT, for the deep penetration, we are using the red color, which is shown on here. However, you can see that the sunlight has all the color, right? And even those blue and the green are having higher absorption by the photosensitizer. So when you are having the photosensitizer in this process, injecting photosensitizer to the patient, and then waiting for a few days. And during this time, you need to avoid light, because at this time, before it goes to 2 or 3 days, normal tissue are also going to have quite high concentration of the photosensitizer. So at this time, if you are, or the patient goes out to the sunlight, sunlight has, all different color from the blue to the red, and those are going to be observed by photosensitizer even in the normal tissue, and then they will kill normal cells, which we should avoid. That's why the patient needs to be in the dark room, which is terrible. If you just imagine that you have to be in the dark room for a long time, the only thing you can do is, I don't know, sleep. But sleep also, you cannot have a 24-hour sleep. So it's not going to be easy for the patient. So that should be not only before the PDT, but also after the PDT. Because there is a chance that photosensitizer can remain in the normal tissue pretty long time. So that the patient has to be in the dark room even like 1 week after the treatment, because there is a high chance that the skin can contain photosensitizer. So that's the disadvantage. And then also, even though we can use 630 nanometer for the PDT for this dihematoporphyrin, but that still has a limitation for penetrating in the deep tissue. So relatively, the kind of surface tumor can be treated by using this dihematoporphyrin. And also, the concentration between tumor and then healthy cell can be very steep for the gradient. And then this production from the cow blood can be actually very expensive. To minimize the damage for the normal cell, what you can do is, as we have seen from the previous table, if you are giving the carotenoid right after laser irradiation, then this carotenoid will binding with the ROS more than the cell, so that it can protect the cells. So second generation for the photosensitizer are shown on here. So they are like phthalocyanine or naphthalocyanine or 4-bis, which is a reduced porphyrin, and also mesotetrahydroxyphenylchlorine, so MTHPC. Especially this MTHPC is requiring to have only 20% of the light compared with the dihematoporphyrin to cause the same level of the tumor necrosis. So that means that this MTHPC can work like 5 times more deeper tissue compared with the hematoporphyrin here. Another one is called as 5-ALA. And then this 5-ALA is 5-aminoabulinic acid. The name is kind of difficult to pronounce. But this one, 5-ALA itself, is not actually photosensitizer. This is a precursor, which means that it is making a photosensitizer by going through a few processes. So when the patient is taking 5-ALA oral intake, this can be also a advantage for the 5-ALA compared with the other photosensitizer, because the other photosensitizer we have to have an intravenous injection. However, for this 5-ALA, you can have just taking as a drug pill. Once you are taking 5-ALA, and then it goes to the liver, and then in the liver, it is used as generating the porphyrin, which is shown on here. And then this porphyrin can be interact with the light so that it can kill the tumor. So skin sensibility means that how much of the photosensitizer will have a chance to cause the skin to be damaged. And this can be measured as an index for the skin edema, which means the skin swelling. So when the photosensitizer are in the skin, and then if that is exposed to the light, then skin can be easily swollen, or it can be sunburned, or even blistered. And then all of this process can happen in a few minutes, which will be terrible, right? So degree of skin sensitivity is shown in this graph from the multiple types of photosensitizer. So DHE, dihematoporphyrin, is shown on here. And you can see that this sensibility lasts for a pretty long time, even like 4 weeks after injection. And the MTHPC is having higher sensibility right after the injection. However, it drops quickly at the 2 weeks after injection. So after 2 weeks, this MTHPC has a lower sensibility compared with the dihematoporphyrin. So which is much better with the dihematoporphyrin. But 5-ALA, as you can see here, it goes down to almost 0, even within like 2 days after injection. So from this graph, you can see that 5-ALA is having much less side effects for the skin or normal tissue compared with other photosensitizer. Okay, so that was so far about the PDT. And then let's look at the biostimulation. And the biostimulation is happening under the very low power, like 1 to 5 milliwatt range. That was first claimed by Hungarian surgeon. The name is, I don't know, Mester. And then in the 1960s, and then he found that by giving the NIR laser using the helium neon or red color laser, he found that the wound healing process is much faster with the light. And also by giving the laser light, it causes the anti-inflammatory effects. So both are very desired effects. So that was the first report. So before, people did not think about using the laser or light for promoting some advantageous process in the treatment, but found that this wound healing or anti-inflammatory effects from the low level light. And then in 1987, the Carew explained that this may be the local wound healing effect is coming from cell proliferation by having low intensity light. However, the effects of the biostimulation are still in controversy, which means that most of reports are saying that this is working, and then this is basically providing some advantageous effects. However, some reports are also saying that it doesn't cause any some good effects. So it's still controversy. However, these days, as you can see from the TV advertisement, I guess maybe it's Garlib or Manar and Nur, you may not really watch Korean TV, but other Korean students may watch the Korean TV, and then you may have seen the advertisement of LED mask or LED helmet. So LED mask for the face skin, LED helmet for the hair. So it seems like that using the low power light is giving some good effects on the skin or hair. But the open question is which of the characteristics of the laser radiation, like maybe coherence, or maybe laser has a very narrow bandwidth of the wavelength, or maybe the polarization among these, which one is kind of important parameter for the biostimulation? Or another question, should we use the laser? Or can we use the incoherent light source, such as the LED? Actually, the answer for the bottom actually already came out, because there are many biostimulation or low-level light therapy using LED is available. So for this biostimulation, not only laser can be used, but other the light source can be also used. However, when you are using other light source than the laser, you need to have a way to limit the wavelength range that you are going to use. This one shows the examples of the effects of the biostimulative effects by multiple studies. If you look at this one, hair growth, wound healing, but shown that no wound healing, and the stimulated collagen synthesis. So by stimulating collagen synthesis, it can actually improve the wrinkle. So when you have a lots of wrinkle or deep wrinkle as the aging process, and then giving the specific wavelength, which is shown here as ND-YAG or helium neon, so red color. And then they found that they stimulate collagen synthesis under the skin so that it can actually reduce the wrinkle, so that making your skin to be look younger. However, also other people found that suppressed collagen synthesis. So it's kind of controversy. And also increase the growth of the cell, but suppress the growth of the cell. And so promoting the vascularization, and then relieve the pain for the teeth application, but no pain relief on the teeth. So these are actually quite old data, up to like 1993, you can see here. And then these days, what people found was this controversial effect of the biostimulation or low-level light therapy is mainly due to the dose. So there is some kind of threshold. So if you are giving the light below this threshold, then it works as a promoting effect. But if you are giving maybe higher than this threshold, then it suppresses the effects. So that is so far known as a kind of reason for why some are causing the benefit, but some are causing disadvantage for that. Also, this table is showing about the gene expression effects of the low-level light. So there are so many things. So proliferation for the specific DNA, and then some are prevent proliferation. Some are going to cause the apoptosis, which is cell death. And some are actually promoting energy metabolism and the respiratory chain. So as you can see, the effects of the laser or low-level light is actually in a wide range for the effect. Also depending on the wavelength and then light energy, the dose. So this graph is one of the very famous graph for the low-level light therapy. So low-level laser therapy or low-level light therapy, both are using LLT, and then or biostimulation, or these days photobiomodulation. That is also another name. And then people found that so far, by giving this LLLT or photobiomodulation, it can reduce the edema and it can reduce the inflammation. And then it can generate actually ROS. And then, or it can actually activate the cytochrome C oxidase in the mitochondria membrane. And then it can actually reduce the neuron excitotoxicity and then reduce the apoptosis or reduce the necrosis, promote neurotrophins, and they promote neuron progenitor cells, which means that the differentiating into specific neurons from the progenitor cell, promoting this process, giving the laser. Or giving the LLT, it can promote angiogenesis, which means the growth of the blood vessels. This graph is from another actual website and showing the same thing. So by giving the light, it promotes the angiogenesis or new blood vessel growth, promotes the collagen synthesis, and also promote muscle regeneration, and then reduce the muscle atrophy. And then bone formation promotion, promoting the cartilage, promoting nerve regeneration, reduce the inflammation, reduce the edema. It seems like LLT is really superpower modality that can do lots of good things for our body. But we need to be careful for selecting the power, and also these effects are actually occurring at the specific wavelength. So not all the wavelengths are going to cause the same effects, but specific wavelengths are causing specific effects. But this table, or this the illustration is indicating that light is actually giving lots of effects on human body, not only for the skin, but for the bone, muscle, and collagen, and even for the neurons like that. So it seems like there are lots of things that we can investigate for the future study. This is another actually the figure which the Seungwon has actually shown in the last presentation. So by giving the laser and then at the 670 nanometer or 800 or 900 nanometer, they can actually promote the cytochrome C oxidase in the mitochondria, and then increasing the cytochrome C oxidase activity. So by increasing cytochrome C oxidase activity, they will promote the generation of the ATP, and then also controlling the reactive oxygen species, and then controlling the nitric oxide. So each of them are going to has different effects. So ATP is actually energy source in our body. So for the cells to work, you need to have an ATP. So by having higher production of ATP, it can increase the cell ability to fight infection, and also it can help for the healing process. But by controlling this ROS, it can have a positive effect on the cell repair or cell healing process. By releasing nitric oxide can work as a vasodilator, which means the increase of the blood vessel diameter. So when there is an increase of the blood vessel diameter, it promotes the blood flow increase also, so that they will increase circulation. And then by having more circulation of the blood, it can decrease the inflammation. And also high blood flow will have a more oxygen transport, and also immune cell transport into different region of the body. So this is actually one of them. And then let me show you another one, which is shown. Let me. So this is another the figure showing about the LLAT. Here, these are showing about the different wavelength effect. So from here, you can see the blue light shown on here. So blue light is cryptochrome's blue light receptor. And then that promotes the transducing cellular signal. And then when you're using the green light, and then there is a green light sensitive opsin channel, which can be actually connected with the optogenetics. And then that opsin channel can be activated by using the green light. And then you can see it can promote some signals. When you are using the red light in the range from the 600 to 850 nanometers, that is mainly working on this mitochondria. And then cytochrome C oxidase. And these are what we have seen in the previous slide. So increasing ATP, and then also releasing nitric oxide so that vasodilation can be happening, and then promoting ROS production, and then promoting NF-kappa B, which is a transcription factor for the neuron. So those are all also working as some activating transcription factor. Also, when you are using light in the 900 to the 1100 nanometer, it can actually affect heat or light-gated ion channel. So this 900 or 1000 nanometer is kind of close to the infrared range. And then it can generate, it can interact with the vibrational mode of the water molecules. And then cells are having either heat-gated or light-gated ion channel in this wavelength. So by giving this 900 to 1100 nanometer light, it can activate this ion channel and then giving the signal process of the calcium signaling. And then it can also promote for the transcription factors. So as you have seen there, this light, depending on the wavelength, the effects are actually different. And then these days, the mechanisms of this biostimulation or low-level light therapy or photobiomodulations are unveiled with many studies. I need to show this one also actually. So people found that this biostimulation or LLT is having biphasic dose response. So when there is some insufficient or maybe too short time, then no effect. However, if there's too much power or maybe too short, then it can also cause the inhibitory effect. So it is important to find the optimal balance between the power density and the exposure time to have the maximum the beneficial effect from the LLT. So shown here is a 3D Schurz model for the dose sweet spot. So there is a stimulation can happen depending on the power density and also the time. And other than that, it could be causing inhibition, or maybe it could be causing no effects. This is showing examples of the effects for the LLT. So as you can see in these photos, looks terrible, right? So it's good that it is grayscale, black and white scale, so that we do not really feel the the badness of the wound. However, these are showing that those wounds, this is really hard to be healed. You can see the skins are kind of detached each other, and that they cannot be really, healed together. But by giving the laser elimination to these regions, even though it takes longer time, which is 2 months, but like every 2 days, giving the LLT for the first week, and after that, once per week. After 2 months later, you can see this wound has been a lot better. And then this has been compared with without LLT. And then with LLT, that promotes wound healing process much faster than the without LLT. Also, this LLT or light therapy can be effective for the seasonal affective disorder, such as the depressive symptoms in the winter or summer. So depending on the season, some people feel depression. I hope all of you do not feel the depression. When you feel the depression, please go outside so that you expose yourself to the sunlight. And actually that actually helps. And then just take a time to walk around, or just come to my office and then talk with me. And then it may help you for the relieving the depression. And then type of depression don't occur seasonally can be also having benefit by having this light therapy, or jet lag, or sleep disorder. It has been shown that by giving the blue light, that promotes the awake of your brain. And also some people are actually having the shift of the working time, so working at night and sleep at daytime. I have that experience for 6 months. After graduating from the master, I was working in the oil company. The name now is GS Caltex Oil Company in Yeosu. 여수 밤바다. That Yeosu has the oil company, and I was working there as just regular the employee. Employee. I'm confused. Employee, right? And then for 6 months, I have working as a night and the day shift working. So sometimes I had to work during the night, and then sometimes I had to work during the daytime. So whenever there is a change of that day and night, that's really difficult for me to adjust myself working at the night. But this giving the light can help for this nighttime work schedule. And also, this light has been also shown that kind of giving advantage for the dementia. And this figure shows the depression score, and then either giving the pharmaceutical treatment or using the light treatment. So both 48 and 48 patients, and then both either taking the medicine or taking the light treatment are showing the reduction of the depression as the time goes. So this is proving that light therapy is working for reducing the depression symptom. So summary for the photochemical interaction, the main idea is that using photosensitizer as a catalyst for the photodynamic therapy, and then no kind of macroscopic observations means that no major some side effects. Typically using red dye laser or diode lasers for the red color for the PDT, but for the biostimulation or low-level light therapy, there are multi different wavelengths can be used. And also typically pulse is long, so either using like 1 second or you can use the continuously illuminating the CW laser source. Power density is very low, and also special application is PDT or biostimulation, which has a name also as LLT or photobiomodulation. So it seems like this very low power laser or light can be actually used for multi applications. So if you have an interest in this field, you can also maybe study in this area. All right, so thank you for today. And then next week, I think we have a presentation. Who are giving the presentation? Manar, do you may remember? No? Jae, do you may remember who is giving the presentation?
Oh, I think there was some change of the members, so
Right.
yes.
So I need to check, and then I may need to switch the materials so that I may need to continue to discuss about interaction, and then maybe we can find out who can do the next application presentation. Jae, are you in the dark room, or you are using the black background?
I'm in the dark room.
Oh, okay. I hope you did not get the photosensitizer. Okay, so have a good day, everyone, and then see you next Tuesday. Okay, bye.
Thank you, Professor.
Thank you, Professor.
Thank you, Professor.